What up, what up, what up? It's the PAC, man. All things physician assistant. Or should I say physician associate, man. In this video, I obviously want to talk about the difference between physician assistant and physician associate. So that term physician associate has always actually been a title. It's just not a title that's commonly used, but it is used amongst medical professionals. I'll give you an example. So let's say I'm a cardiologist. I'm a well-known cardiologist in my community with a well-established practice. And my practice is getting so busy that I need some help. So I decide to hire another doctor. And let's say I hire a doctor who's coming out of let's say fellowship, and you know, they don't have a name for themselves yet, and they don't have any patients yet. So I decide, hey, you know what? I'm gonna pay you, let's say, $250,000 a year to see patients out of my clinic, out of my practice. In exchange, I'm gonna bill under your license number. So that's a physician who's associated with my practice. That's a physician associate. It's a term that's always been around. It's not like a program you go to school for. They're doctors, but they're associated with a practice. Much alike, like a lawyer is associated with a firm. They may not be a partner in that firm, but they're associated with that firm, right? So it's the same concept. Any doctor who doesn't own the practice but works out of that practice is a physician associate, associated with that practice. So what's gonna happen if we take over that title? Probably nothing, because, I mean, who is it really affecting? Other than some legal paperwork that needs to be changed, the patient, let's say on the ground level, the patients don't know who's who. The patient addresses you by however you address yourself. If a physician associate walks in and says, hey, I'm Peter Molina, I'm the PA, or hey, I'm Dr. Blank, whether you're an associate or you own the practice, the patients don't know, don't care. Just, you know. So in that case, I don't think this is gonna affect anyone. So you know what? That's awesome that the profession is moving in that direction and getting closer and closer to autonomy. And as far as physician assistant itself, I do feel like it's an obsolete term, at least for myself in my practice. I work in family medicine, and in my practice, we have 100% autonomy. There is no one I report to. You know, I don't present my patients to anyone. I don't need to check with anyone before for me to do whatever I think is best for my patients. So in that sense, the term assistant just doesn't make sense. Like, who am I assisting? And but there are scenarios where a PA is in an assistant role, and it's perfectly fine. An example would be, let's say I'm a surgeon, and I can't be in two places at the same time. So I can't be in the operating room doing more surgeries and in the clinic scheduling more surgeries. So I hire an assistant. I hire a PA to run the clinic. Basically, you line them up and I knock them out. And that's a perfect, beautiful mutual relationship between a doctor and a PA. And that makes sense. You're in an assistant role. You're assisting them. Like, look, I'm going to assist you to make more money in this practice, and we're going to do good together. So all in all, kudos to the PA profession. Kudos to my profession. Kudos to your profession. Kudos to your future profession if you're considering becoming a PA. I think the profession is most certainly heading in the right direction, and I think it's definitely gaining some traction. And I just love, you know, I think it's beautiful I think it's beautiful the direction that we're heading in. So anyways, that's all I got to say on the subject. Love you guys. Stay up.